What have you seen over the past 24, 36 hours? How is the ceasefire impacting people there who are in such desperate situations, desperate condition?
Well, happy to see you again, Marcia. As you say, people are still in a desperate situation. Situation is not going to ease overnight. So we need full access. We at WHO, we managed over the weekend to go to the north, to Al Ahli Hospital, to visit a few other hospitals. We managed to get in some medical supplies on Sunday. 8 trucks got in with supplies, not only for WHO, but other medical partners. But we need this continuous and unhindered access because the burden of hospitals will not go away immediately. We need to have supplies for hospitals to be able to deal with people who are still there. But not only that, health priorities are huge. We need to medically evacuate more people. More than 15,000 people are waiting to get evacuated to get medical care somewhere else, and more than 3,800 of those are kids. We need to provide specialized health services because most of hospitals that are still barely functioning in Gaza are providing only basic services. We need specialized health services to be available. We need to bring in specialists. We need also to take care of mental health. Over 1 million people in Gaza have lived through a horror, through constant fear, exposed to death, to destruction, to hunger, and they need mental health and psychological support. We also need to take care of people who have life-changing injuries. Our latest report showed 42,000 people have been injured in a way that they need continuous rehabilitation process. And there are so many other aspects of health system that we need to support. For this, we need this ceasefire to hold. We need continuous access, and really we need all the medical supplies we can get in as soon as possible.
Yeah, the need is so great. I'm wondering what you're hearing from your team on the ground as to the level of organization. Is one group in charge? Like, how do you navigate that, given the fact that, as you say, the demands are so great?
Well, we work with the medical workers, we work with doctors and nurses, those who are still there. Let's not forget, 1,500 medical workers have been killed. Gaza medical workers who worked in hospitals and health centers have just been killed. So there is a lack of medical personnel. There is a lack of specialists, especially in various medical fields. So we will work with all medical authorities that are in place to rebuild this system health system as fast as possible. But again, people are on the move. We talk to many people. They are hopeful, but they're also scared. And they are traumatized. They are deeply traumatized. So we need to be there. We need to support health workers of Gaza. We need to support the Ministry of Health to rebuild slowly, very slowly. It will take a long time to rebuild health system, but we have to start somewhere. So 500,000 of women who may need prenatal, antenatal care can get that. People with chronic diseases. And again, people are still living in shelters. There is a risk of infectious diseases. Demands are huge and needs are immense, and we need to start as soon as possible.
Tarik, thank you so much. Tarik Jasarevic is a spokesperson for the World Health Organization, and thanks for the work that you are doing.